Well, I know our audience won't see you because we're giving you the confidentiality. But I will tell you, your face looks just really great energy in your face and your eyes today. You you look like it'd be hard to know that that event happened to you.
I felt like I looked like 10 years younger than I've been looking. It's hard for me to even believe that I've gone through what I went through because I'm on the other side. It's behind me. I mean, I don't have these god ugly scars on my body because the NeoGenesis even helped the scarring, not just the burn and whatnot from the radiation. So I'm good. I'm whole.
So Sharon, as I mentioned before, a great place to start is just a brief history on how you learned of your cancer and what kind of cancer you were diagnosed with, and then the treatment plan that they then gave to you. And then we'll talk more about how you met Holly and Neogenesis.
My journey started just with a annual mammogram. So in December of 2022, I had my annual mammogram right at Christmas time and was called back in January to have another follow-up mammogram and potentially a ultrasound. So I did have both of those in January of 2023, and the radiologist he referred over to the breast cancer program at South Shore Hospital because there is something that is not looking normal. And in March, I had my initial appointment with a practitioner with the breast program. She was, I'm not worried about you. If this were anything, there's only a 10% chance that it's anything. If it were anything, it's so early and it would take 2 years for it to grow into the size of a bead. Never even felt anything. They did their own images. I had more mammograms and ultrasounds. And then in April, I had a needle biopsy. It showed something called lobular carcinoma in situ, LCIS, which is not cancerous, but it is a risk factor for cancer down the road. So I was referred to a surgeon to hear out my options, which were to either have it removed or to just watch it because it's not cancerous. So I opted, no question, have it removed, get it out of my body. I don't want to have to worry about it. And I did have my mother and my grandmother both had breast cancer. So I had the family history. So it wasn't even a question, just take it out. And in June, I had it removed. And it was then that they actually did find some cancer. So I went into the first surgery thinking that I was home free. The surgery, pathology from the surgery revealed what was called micro-invasive cancer. So little. So I was so fortunate to have it removed. So it did take 2 more surgeries. Although the margins were totally clean of the micro-invasive cancer, they still showed some of the original non-cancerous cells, the LCIS. So the surgeon wanted to make sure that we got clean margins. So that actually did take 2 more surgeries. So I was in for a total of 3 surgeries. Recommendation was 4 weeks of radiation. So I had my last surgery October 4th, and I had the plan to do the radiation. I all along had been, before this all started happening, connected to Christina from Holly's Looking and Feeling Fab family, getting facial treatments with her. So I was keeping her updated all along on what was going on. And then when I was having the second surgery, there was going to be lymph nodes were checked, started talking about skincare and using first just an oil for the scars and stuff. But then when it came down to having the radiation, I decided to apply for the Looking and Feeling Fab to, really get the benefits that of what Holly's group has to offer. So, and then Holly, I guess, reached out to you guys to hook us up and get me on some skincare, and so I was all in. Anything I can do to get through the event. The radiation was the most traumatic part for me. So to have the support of the skincare and actually have the support of all of you to help me through was just amazing.
So how did things go for you through the radiation? And did your doctors talk to you at all about how your tissue looked compared to other patients that they had worked with? Did they give you a sense of comparativeness?
They wouldn't compare me with other people. I made it clear to them that I was not using their products and that I was using NeoGenesis. They weren't all on board with not using what they recommend and what they were willing to offer. But I did get people who did, say that my skin looked extremely, extremely good. I felt comfortable with where I was at, which to me was more important than, really what they had to say outside of just that they did say that my skin looked good.